So for our presentation, we decided to use the article about anti-inflammatory properties of breast milk.
Breast milk consists of water, carbohydrates like lactose and oligosaccharides, lipids, protein like lactoferrin, vitamins and minerals, and antibodies.
Our group was interested in this topic due to breast milk being used throughout history to treat various injuries and illnesses, both internally and externally. We are also interested in this topic due to the recent rise in use of breast milk in skincare products such as lotions and soaps to treat multiple skincare and irritations and infections. And then finally, we're interested in this topic due to our curiosity in why and how breast milk can be used to treat these injuries and illnesses.
So just to start with, some abbreviations that are used are THM, which stands for topical human milk, and HM, which just stands for human milk. So in the article that we used, it went over the many uses for THM. It also went over how THM helps with the prevention and treatment of multiple maternal and infantile complications. And these complications can be ones that have to do with the skin and mucous tissues. These can include lesions and also issues such as conjunctivitis. The article determined that to this date, there have been no negative side effects for its use, and that human milk is a safe and accessible alternative to multiple remedies that are on the market today.
We looked at a couple different figures from some of the smaller studies that this study analyzed. So in this figure 2, and one study shows the effectiveness of human breast milk as a topical agent to aid with the drying of umbilical cords in infants. And this figure shows that the application of human breast milk to the area decreased the overall time needed for the umbilical cord to fall off when compared to the control group. For instance, 23 out of the 30 infants in the experimental group had their umbilical cord fall off after 4 to 6 days, while this happened for only 9 infants in the control group. And then a second study that was in this larger analysis, it shows the effectiveness of colostrum at decreasing the frequency of conjunctivitis in newborns. And while this data shows that colostrum is not as effective as an antibiotic, those infants who had colostrum applied to their eyes were less likely to get conjunctivitis than those who had nothing applied. But overall, these various studies that were in this larger study show differing effectiveness of human breast milk as an anti-inflammatory for a myriad of skin and eye diseases.
The 2 exam questions that we came up with are, what would the outcome of applying breast milk topically to eczema be? And the answer to that is breast milk would help heal the eczema. The irritation, itchiness, and redness would all settle. And then also, are there any known side effects to applying breast milk topically to damaged skin? And the answer to that is no. To date, there aren't any known adverse side effects. And then here are our citations.